Hi ladies, so today I am 34 weeks and 3 days pregnant and I have a lot to go over today, so I will give you a kind of a heads up of what is going to be included in this, and then next week's video will probably be shorter because I'm just going to catch up from last video until today. So it'll be like a week and a half's worth of information. So I'm going to talk about my doula, a prenatal, then I had a prenatal today, and then just the happenings of this past week and a half. So let's see. Last week I started taking 2 red raspberry leaf tablets. This week I'm taking 3 a day, and watch last week's vlog if you want to know more about what that is. I got my blood work back and everything looks stable, so that's good. If you don't know, I have beta thalassemia minor. It makes me anemic. And so they're monitoring my hemoglobin count. It's currently 9.1, which is low, but it's been staying at that. It hasn't been dropping, so that's good. So last Thursday, like a week ago, I had contractions every 10 to 15 minutes for like 4 or 5 hours one night. I didn't think I was in labor because I've been in labor and like they weren't getting closer together or stronger. They were just pretty much the same. But they definitely felt like more than Braxton Hicks. Like they're very pressureful, and I feel them in my back and then also in my cervix. And then my whole belly gets hard, and they last about 1.5 minutes each. And so, I don't know, it's just something that I'm used to with having contractions in pregnancy, and yeah, so I don't know, they're just, contractions are starting mostly at night, or if I'm really busy in the day and I don't drink enough water, then I'll get them too. So I've noticed I'm getting tired. I'm wanting to stay up late at night, and then I get tired during the day, and that's just how things have been happening. I don't want to stay up for any particular reason. I just feel more awake at night. I'm more tired during the day, and then because of the contractions, I don't feel like it's labor. I don't feel like labor is like imminent or anything. But it did kind of get my butt into gear to pack our hospital bags and things like that. So I packed the hospital bag, the baby bag, and the kids' stuff. They're not fully packed, but the suitcases are out, and I can throw things in them, you know, when I think about it. So they're definitely in the works of being ready for that. And then this week, the baby's movements have changed, like how I'm feeling them. They're not so much punches and kicks anymore, but like more pressure of like the baby trying to move, but you know, it doesn't get very far. We went swimming this past weekend, and like as soon as my belly was under the water, I felt the baby float up out of my pelvis. And then yesterday, I swear the baby was breech because I thought I felt him flip. And not only that, I have a Doppler, and like usually I can find the heartbeat low, and this time I could find it only above my belly button, which is a sign of a breech baby when the heartbeat sound is louder at the top. So at my appointment today, I did have them check me because of all the contractions that I'm having. I'm 1 centimeter dilated, and she said my cervix is still pretty long and not too effaced or anything like that. It's just a normalness of a 3rd pregnancy, especially with the irritable uterus. And in some women, like, that might be a concern. But since I've had 2 term vaginal births, that the chances of me going into labor and delivering early are low. so that they're not too concerned about it. And she felt my belly, and she tried to figure out the position of the baby, and she thought the baby felt breech. So we actually did a quick ultrasound to see the position of the baby, because if the baby was breech, I wanted to do everything I could to flip the baby. And so we found out the baby's head down. So that's good. And it was just like the OB did the ultrasound, so it was really quick, like just find out the position of the baby. But we did see his little head, and we could see a little wisp of hair coming off of his head. So my other two were born with like full heads of hair, and so I was excited to see that this baby may have a full head of hair as well when he's born. So for weight gain, I actually haven't gained any weight since my appointment 2 weeks ago. So, but I've been really hungry and really eating a lot, so it kind of surprises me that I haven't gained weight, but I haven't. And then my doula came over this last week, and we just went over my preferences, and then she practiced a lot of techniques for managing pain and labor. My children are really distracting me over here. And so my husband, the good thing about it is, like, I know the comfort techniques, right? But my husband doesn't necessarily know them. And so she would demonstrate something and then have him try. And so it was nice to have him get to practice things, and then also we kind of walked around the house. Like I showed her the bathroom I would be laboring in at home and those kinds of things. So if we do labor at home and she is here with me, she'll kind of already know the lay of the land. So that's what we did.
Look at my jewelry.
They're beautiful. So that's what we did at the doula appointment. And then that kind of got me into writing my birth preferences. And I was going to give them to my doctor today, but she actually wasn't there. She was in a procedure, and I was waiting for an hour, and so they just let me see the other OB. But I did turn my preferences in, and I went over them with that OB. She's going to be on maternity leave, so I still need to go over my actual preferences with my doctor. So I'm going to go through my preferences in this video in just a moment. The only other thing that happened this week was we had maternity pictures taken on Monday. I don't have them back yet, but I will show some to you when I get them. And alright, so this is my preferences. Let's cover up our name there. So this is what it looks like. I have a little thing to nurses and doctors up here, and then I have labor, delivery, cesarean, and newborn care, and I have it broken into sections. And then also everything is bulleted and just very easy to read. If you write like paragraphs and like a lot of information, it's not easy for them to like skim and get a good idea of whatever you're trying to say. And they like it to be one page. So that's just what I know as a doula. So I'm going to read you the like top part of my preference. Okay, so it says Abby and Michael's birth preferences. That's my husband's name. It says, thank you so much for being part of our birth team. We understand that birth is unpredictable and may not go as planned. These are our preferences for our labor, delivery, and newborn care. So for labor, these are just bulleted. I'm going to read exactly what I wrote. These are things that I want: to labor at home for a while before heading to the hospital. I would like my husband Mike, our doula Meg, and my friend Heather to be allowed in the delivery room. I want to labor in my own clothing. I want to drink clear fluids to thirst. I do want a hep lock. I would like freedom of movement. I would like Doppler monitoring. I would like to avoid the use of any pain medication. I would like non-medical interventions to be considered before Pitocin, if needed. I would like my water to break on its own. I would like the pros and cons of any suggested intervention explained. I would like to labor in the tub, and I would like to labor as naturally as possible. So that's labor. And for delivery, my preferences are, so for delivery, I had a 3rd-degree tear with my first, and so I took a lot of preventative measures during delivery with my second. So the things that worked well are in my delivery preferences. If you think it kind of sounds weird, it's because I don't want a 3rd-degree tear again. So I would like warm, moist compresses placed on my perineum while pushing. I would like perineal massage between pushes. I would like encouragement during pushing, but no coaching or counting. Like, I don't want them to say, oh, here's a contraction, and then count to 10. Like, I want to push for 6 seconds if I want. Or however, whatever feels right, that's what I want to do. I want to follow my body's urge to push. I want to choose whatever position I feel like I should push in. I want to pause in pushing when I feel the ring of fire, to allow time for the perineum to stretch. And the best thing I've seen women do when they want to pause is to like blow, like they're blowing out a candle, like, and that kind of breath helps fight the urge to push. So that's what I want to do when I feel that. And then I would like to touch the baby's head when it's crowning. It just, I didn't do that with my first, and I did that with my second, and it just made pushing easier. I don't know why. It was like, you kind of realize how close you are to being done, and it gives you that little extra oomph to like get through it, I think. I want to delay the cord clamping. I want the placenta delivered before cutting the cord, or at least before any medications given. So if they're going to give me Cytotec or Pitocin for bleeding, I want the cord cut before the medication is given. But I would like the placenta delivered first. So I would like placenta delivered, cord cut, then medication, but we'll see. I would like to cut the cord myself. I've never cut the cord. My husband's always done it, and I think it'd be really neat to cut the cord, so I would like to do that. And I will be keeping the placenta. I'm not, unless I change my mind in the next few weeks, I'm not encapsulating it or consuming it or anything. I would like to like plant it under a tree. I might dry some of it and make something with resin with it. If you guys don't know, I cast breast milk, placenta, umbilical cord, baby's first haircut, baby blankets, baby clothing, all of those kinds of things in resin. And I make like Pandora style beads and pendants and pretty much whatever someone wants I can make. So I might keep some placenta to make something like that. The placenta pieces, I'll put one in here. Like, it's beautiful. It looks like, it almost looks like copper jewelry, but it's placenta. And I paid my whole doula's fee from selling jewelry made from breast milk and placenta. So that was pretty cool that I was able to pay my doula fee with breast milk and placenta. So anyways, okay. So I have a cesarean section on my preferences here, and it's because it's better to fully think through your preferences when you're not in pain, when there's no imminent danger, when you can fully think through what your options are. And so I just include it in the birth plan. I'm not hoping for a cesarean. I want to do everything I can to avoid it, but if it comes down to that, I want to have it on my birth preferences. So for cesarean, I would like to have at least one arm unrestrained. I would like my husband or doula, if she's allowed back, to have a bottle of peppermint oil with her or him so that I can smell it in case I get nauseous. Like, smelling peppermint really, really helps. I would still like the delayed cord clamping. I want my friend Heather in there to take photos if she's allowed. Obviously, I want my husband and my doula there. I would like the uterus repaired without lifting it out of the abdomen. I would like skin to skin right away with the baby, but if that's not possible, then I would want skin to skin with Dad instead of taking the baby right to the warmer. I would prefer a spinal block over an epidural. And I don't want any medication given that would cause amnesia. Like, I want to remember what happened instead of have it all be amnesia-y. When the baby is pulled out, I would like to be asked to give a push. And I would like there to be a pause once the baby's head's out before the body comes out. That can help clear fluid from the lungs, just like in a vaginal birth. And then if there's time, and for some reason I would have a planned cesarean, I would like to do a micro swab. And you can research more of that on your own. I don't want to really get into it. But basically, it's a way to colonize the normal bacteria from birth in the baby. And it helps build the immune system and all the beneficial bacteria that a baby receives during a vaginal birth doesn't happen in a cesarean. And so this is a way to have that available to the baby, the bacteria, but you can't really do it like once your water breaks or there's any bleeding or anything. It's too late to think about doing that procedure. So it's more of like we're planning a cesarean and you have to do it ahead of time kind of thing. You have to have it ready to do ahead of time. And then for newborn care, I want to delay newborn exams. I want baby directly to me for skin to skin. If not possible, then to Dad for skin to skin. I want no extra visitors in the first 1 to 2 hours after birth. I want to delay the eye ointment. I want the baby to be able to see as well as it can see while it's born and then while it's nursing. And then once he gets to that sleepy phase after he feeds and the first hour or two of alertness, then they can do the eye ointment and then he'll go to sleep and it won't be an issue. I would like to breastfeed as soon as possible. We will be keeping this baby intact. I would like to delay the first bath for 24 hours, and then I want to give the baby a bath myself. And we're not doing the Hep B vaccine in the hospital. Doesn't mean we're not doing it. It means I don't want to do it at birth or the first day or two. So those are my preferences for labor, delivery, if we would need a cesarean, and then newborn care after baby arrives. So I'm going to have several copies of this. I highly recommend taking like maybe 5 copies with you because you'll give one to your nurse in triage and might get lost. And then your doctor will have one in your chart. Hopefully you give one to your doctor. And then you can ask your doctor to sign it so that if your doctor isn't on call, the other doctor can see what you have agreed upon with your doctor. Some doctors don't like that. Some will sign it. And then you'll also give it to the nurses in labor and delivery with you. And then if there are shift changes or anything and it gets lost, you can always give them another one. Like, I think I was only in the hospital for 2 hours before Annabelle was born. And I think I had to give 4 of these preferences to people. Because I don't know what happened to them, but I was glad that I had extras. So that's kind of my birth plan. Connor was a induction with epidural. A lot of interventions led to a lot of complications, which led to a 3rd-degree tear, and we were both fine, but recovery was hard, and I don't remember much of it, and he was very sleepy when he was born, so like feeding was difficult. With my daughter, labor started spontaneously. I didn't have any medications in labor. I delivered her without any and yeah, she was born, and recovery was so much easier after her than my first. And so unmedicated labor is no joke. Like, it hurts a lot, but it's pain with a purpose, and if you listen to your body, it goes a lot faster. Like, it's pain with a purpose, so when you feel something, your brain and body kind of tell you what to do to lessen the pain, and all of those things that you do kind of help labor progress. And when you can feel and control your pushing, for me, I feel like you're less likely to tear and things like that. So for me, recovery after my unmedicated birth was like so much easier. I felt better that day than I did 8 weeks after I had my son, for real. And yeah, I don't know. So my preference is to like avoid interventions if I can. Like I said, labor's unpredictable and you never know. So I am aware of that as well. So I'm going to show you the belly, and then that will be it for this week. Alright, here's baby belly. Yeah. What? And from the front. From the other side. See if I can show you this belly. It's pretty big. So the ultrasound showed his head down here, and his booty is right here. And his booty felt like a head when she was feeling my belly, but we confirmed his head is down here, so that's good. So there he is. Alright, thanks for watching, and I will see you ladies next week. Bye!